Hello, everybody. Welcome. I know that there's still some people coming in, some attendees coming in as we opened up the Zoom webinar. My name is Michelle Bird. I am Larimer County's Public Affairs Director. I am going to be your Zoom host this evening, which kind of means that I'm part facilitator, part IT person, but hopefully with all together we'll get through this evening. Really quickly, I want our panelists to introduce themselves before we review the agenda. So I'm just going to go through our panelists one by one and have them introduce themselves, say their name, and tell us what they do with Larimer County. So I'm going to start with my two county commissioners. Commissioner Johnson, go ahead.
Good evening. My name is Steve Johnson. I'm chair of the Board of County Commissioners for Larimer County this year.
Thank you. And Commissioner John Kafalis, go ahead.
Thank you, Michelle. John Kafalis, Larimer County Commissioner, District 1, and I am here to listen.
Thank you, Commissioner. David, go ahead.
I am David Bragg. I'm a facilities project manager with Larimer County.
Thank you, David. Keith, you're up.
Hi, my name is Keith Meyer. I'm with Ditesco. We're representing the county on the project as project manager for the behavioral health facility and transfer station.
Thank you, Keith. Ken Cooper, you're up. Ken, you gotta unmute yourself.
Yeah, good evening, everybody. Ken Cooper, Facilities Director. Sorry for the delay. We appreciate attendance tonight, and we hope that the information is very helpful for you.
Thanks, Ken. Lori Kadrich, your turn.
Good evening, Lori Kadrich, and I'm the director for a service area called Community Planning and Infrastructure Resources, and that includes the landfill operations.
Thank you, Lori. We're gonna jump to our next Lori. Lori Stolen, go ahead.
Good evening, everyone. This is Laurie Stolen, Behavioral Health Director for Larimer County.
Thank you, Lori. And Lou. Lou, go ahead.
Good evening and welcome everyone in Zoom land. I am Lou Perez. I am the interim solid waste director for Larimer County.
Thank you, Lou. Now, I don't think I missed any of my panelists, but if I missed one of my panelists, if they would jump in real quick and introduce themselves. If not, I just want to really quickly review the agenda for this evening. We have about 90 minutes and we've used about 4 of them already. So we'll get going really quickly. Of course, we just did introductions. I'm going to give a little overview of the Zoom webinar and how you guys can participate. Then we're going to jump into a presentation by some of our panelists about the 2 sites we're here to talk about tonight, the behavioral health site and the transfer station. So give you guys some background on the project. And then finally, we will go into Q&A where you guys can tell us what you think or ask any questions that you have. Just a couple things about the Zoom function and this webinar function. First of all, it is, you'll notice it's a Zoom webinar, which is a little bit different than maybe some of the Zoom meetings you've been involved with before. We use the webinar format for primarily safety reasons. I'm sure many of you have heard about Zoom bombings in the past, where someone takes over the screen and probably puts some very inappropriate things on the screen or says some very inappropriate things. And so that's why we use this webinar feature. Number one, it doesn't allow attendees to share their screen or their video. And second thing, it doesn't allow attendees to share links out to everybody. So one of the safety functions or the safety issues that can happen is you'll have an attendee come in, share a link out to all the other 100 or so attendees, and people click on it and it puts a virus on your computer, or you can have ransomware, stuff like that. So that is why we use this webinar function. For those of you that are using the Zoom app or you're on your computer using Zoom tonight, there's a couple of different ways you can participate. The first way is you can use that raise your hand feature that you'll see there. Some screens are a little bit different. Sometimes it's down below. Sometimes it's in that participants panel where you hit more and you'll have the ability to raise your hand there. Or you'll notice we have a Q&A function down below. If you click on that, you can type in your questions. And after we get through our presentation, we'll go through and we'll get through as many of those questions that we can tonight. For those of you that have dialed in, I know some of you maybe aren't on your computer or using the app on your phone, you dialed in. You guys can still participate as well. What you need to do to raise your hand, so I know you want to speak, you're going to hit *9. That'll indicate to me that you need to raise your hand or you're wanting to raise your hand and speak. When we get to you, I will go ahead, and this goes for both. Once we get to your turn, we'll go ahead, I'll allow you to speak. I'll let you know it's your turn. I'll allow you to speak and you'll have to unmute yourself. For those of you using Zoom, there's usually an unmute down in the, I'm not sure if this is mirrored or not, but down in the bottom corner on your left side. For those of you that have called in, it's *6 and I'll walk you guys through that. Again, we want to use that Q&A function tonight for a couple different reasons. The primary one is we probably won't get through everyone's questions tonight. We have quite a bit of questions come in. Hopefully we answered a lot of those questions in the presentation, but if you feel like there's other questions you have or you need more clarification, we will go ahead and answer those questions as well as we can tonight. If we don't get through everybody's Q&A, the Zoom function is really neat and it saves all the Q&A and it'll tell me who didn't get their their questions answered. And we'll be able to email you answers back to your questions. We'll have staff that can do that later on. Final thing I want you guys to know before we jump into our presentation is that this event is going to be put on our YouTube channel tonight. So you'll be able to go back and watch it, or maybe you had a neighbor or a friend or a family member who wasn't able to participate tonight. They'll be able to go back and watch it as well. And we will have a questionnaire. So as many of you participated in the pre-event questionnaire, we appreciate your input. And hopefully we get all your questions answered tonight. But we'll have a similar questionnaire to fill out afterwards. We'll email that to you guys tomorrow. We'll also have it available on the website. And anybody can participate in that questionnaire, even if they didn't attend tonight. So we'll get that available for you guys. So without further ado, I don't want to take up any more time. I am going to turn it over to Keith. Keith is going to start us off with his presentation. Again, feel free to use that Q&A function at the bottom. We're going to get all the way through the presentation before we start answering Q&A. But if you have a question as Keith is presenting, please go ahead and type it in so that you don't forget.
Michelle,
Right.
I think Commissioner Johnson wanted to make some introductory comments. So let's start with Commissioner.
I did forget about my Commissioner Johnson. Commissioner Johnson, go ahead.
Thank you, Michelle, and I want to thank everybody for joining us this evening. We're very excited about two projects that Larimer County is engaged in that have the potential to greatly improve the lives of all Larimer County residents for generations to come. First is our landfill. Our landfill will be closing in a few years. We've known that for several years. That landfill was constructed in the 1960s according to environmental standards back at that time, which of course are vastly different today. We have the opportunity with constructing our new landfill to construct a landfill that will be much more environmentally responsible. And we have the opportunity to add several new functions to our landfill that will increase the diversion of materials from the landfill to about 40% according to plans that have been developed by consultants and our master plan. This is a significant advancement in the management of solid waste in Larimer County. The second thing we're going to visit with you tonight about is our behavioral health initiative, which the voters approved in 2018. It has two main goals. It provides several $1 million of services in communities throughout Larimer County to improve access and treatment for mental health services for many folks that can't get them. The second part of that initiative is the construction of a facility to provide a number of services and benefits: assessment, stabilization, short-term intensive residential therapy. These two projects will make a major difference in Larimer County, and they're located on a piece of property about 300 acres south of the current landfill site. The county has a long history with that piece of property. Initially, we acquired it thinking that we could expand the current landfill onto that site. But some geological work revealed that that site was not suitable for a landfill. The county retained ownership of that site, which is zoned heavy industrial, by the way, for future uses. It was it's remained vacant, but it is not open space, and it was not zoned open space, and it's not been accepted into the county's open space plan. So the two facilities that are going to be constructed on this site, first off is the transfer station. The transfer station is a part of a solid waste master plan, which has been developed for several years in Larimer County with participation by the municipalities of Larimer County, the waste haulers. We had a stakeholder group of citizens, of providers, of users of solid waste and contributors to it, of environmental interests, and citizens guided that process for several years and developed these strategies, and one of which you'll hear about tonight is the transfer station. The second is the behavioral health facility. And that is the result of the behavioral health master plan, which again was a process that was developed over several years. This particular master plan was adopted by the county in August of 2018. And in this master plan on page 28, it says, the Larimer County Board of Commissioners in January of 2018 Administrative Matters meeting made a significant commitment to locate the facility, to earmark a facility at the land at the intersection of South Taft Hill Road and Trilby Road. That site has gone through an extensive vetting process with providers, with users of mental health services, and the site was one of 10 that were evaluated in a very extensive process. This site is the only one that met really the requirements and the needs of this type of a facility. That has been confirmed by another site selection work that we did when we were looking for a site for our fleet shop. Commercial sites or industrial sites are very hard to find in Larimer County. All of the providers have indicated to us that this site, with its calm, peaceful, tranquil setting, is exactly the kind of facility that they envision as best for treating individuals that are seeking behavioral and mental health services. We are aware that locating any facility has impacts upon the neighborhood. The current landfill has had impacts upon the neighborhood. Larimer County is committed to being a good neighbor. And one of the benefits of this meeting tonight is that you will get to meet and interact with Lori Cadridge, our new Director of Community Resources Planning and Infrastructure. You'll get to interact with Lou Perez, who's managing our landfill, and you'll get to interact with Lori Stolen, who will be managing and running our behavioral health center. They are all very committed to making sure that these facilities are good neighbors, that the impacts that we know we will have on neighbors can be minimized and dealt with. We have already worked with some of the neighbors to the west of this site in the Hidden Springs subdivision. For example, one of the things we did was to redesign the access point road to the transfer station so that it would not direct people into their subdivision, so that it would direct people into the transfer station and place a gate at their subdivision so it would not impact their roads, which they maintain. Those are the kind of things the county is committed to do as we build and operate these sites and be good neighbors. So thank you for participating in the meeting tonight, and I know our staff is very interested to hear how we can be good neighbors with you.
Thank you, Commissioner Johnson. My apologies for
That's okay. And I'll turn off my video so the others are not interfered with.
Awesome. Thank you, Commissioner. All right, now we're going to head on to Keith, and he's going to give us some background on these two sites and what's planned at these two sites. So Keith, go ahead.
Great. Well, thank you, Michelle. Thank you all for attending the presentation this evening. I will be sharing my screen and giving a brief presentation on the behavioral health facility. So if you don't mind, Michelle, confirming that you can see my screen, and then we'll proceed forward.
You are on, Keith.
Perfect. Thank you. So again, we're here to talk about the solid waste transfer station and behavioral health facility this evening. A little bit about the site. Thank you, Commissioner Johnson, for giving such a great background and making my presentation very easy this evening. The behavioral health facility is currently planned at the northwest corner of Taft Hill and Trilby, and then further to the west from there, the regional transfer station. So this is an overall site plan The roadway configuration that Commissioner Johnson mentioned as far as making the minor road to the west to Hidden Springs is illustrated on this plan. The facilities are about 1,500 feet apart, so there's really good separation between the behavioral health facility and the transfer station, and certainly the behavioral health facility from both Taft Hill and Trilby. A few perspective renderings. This is looking from the Taft Hill Trilby intersection back to the northwest, and it is taken at about 30 feet in the air, so it gives you a perspective of both facilities and their scale relative to the foothills beyond. So this is just an illustration of a rendering of what those two facilities adjacent to one another look like. At eye level at the facility, looking back towards the northwest of both facilities, again at the Taft Trilby intersection, both facilities, and it's certainly a little bit different orientation here, looking maybe more northwest. Both facilities, their scale is represented here from the intersection perspective. So a little bit about the overall project summary. A little bit of it is redundant from the commissioner's introduction. And again, the master plan was completed and approved by the commissioners in 2018. The transfer station will serve all of Larimer County. It's about a 64,000 square foot building that collects commercial and residential solid waste. We're hoping that a lot of the trips are reduced in the southern or northern portion of the county, because the southern portion of the county will be using this facility for transfer, and the remaining residents will go north to the new northern landfill north of Wellington. The facility is planned to have scale houses and a gate entry similar to the existing facility, except this facility, every roadway in and out of the transfer station will be paved. So much less dust and impact from that manner. It will have a small administration building adjacent to the transfer station that will house county staff. There will be about 30 trucks a day transferring solid waste from this facility to north to the new landfill. So again, the transfer station's purpose is to collect solid waste from residential and commercial haulers in the southern portion of the county, load that material onto transfer trucks, and then have those transfer trucks take it north to the northern new landfill. There is a planned future construction and demolition recycling area just north of the transfer station proper to accept construction debris essentially and allow that stream to be recycled. The facility will have a 3-day holding capacity so that we can continue to accept solid waste from the communities it serves during windy days and inclement weather, and then still transfer waste from there north, as I mentioned earlier. It is an improved disposal area for all customers because it is an enclosed environment. It's going to be a great customer experience for folks dropping off solid waste to the facility compared to what currently exists at the landfill. The Trilby Road entry, we talked a little bit about that already. It's going to be reconfigured so that the roadway to the west is renamed as Hidden Springs Road, and it becomes more of a minor roadway that is not encouraging use essentially of that roadway back to the west and directs all traffic into the transfer station. So a little bit about the northern landfill in perspective here overall for how the transfer station and the northern landfill are oriented. So this is an aerial image of the town of Wellington. About 5 miles north of that is the county property for the new landfill. And so this particular facility we're talking about this evening will transfer waste to this new landfill property once both are open and operating. As part of the regional study for operations of the transfer station, there was extensive work done on haul route studies as to the most efficient route to provide the minimum amount of impact to the citizens of Fort Collins and surrounding communities to transfer this solid waste north to the landfill, the new landfill. And so the current route is shown in pink on this map that would take and that's the recommended primary route for the haul trucks that would take solid waste north along I-25 to the new landfill property. A few more perspective images is what the facility will look like. On this particular perspective, again, looking northwest, the facility has residential tipping pad and entry for all residential users on the right side of this image. The tunnel beneath the facility that actually the transfer trucks use to be loaded is on the forefront of this image, this picture. And this shows also the small administrative offices on the south side of the facility. An aerial perspective of that same building looking downward, you can see the small administrative office and then the transfer station itself, the residential drop-off area to the right of this image, which is to the southeast side of the building, and then the southern parking areas. The white area on the north side of this image is meant to be the future construction and demolition waste recycling area. And then just another quick perspective, kind of looking more towards the north directly of the facility from the parking lot areas on the south side of the building. And then this one shows the gatehouses. So this is the gatehouses and essentially the main entry where the scales will be located to enter the facility for all both commercial and residential users. This one is this particular slide is relative to the Hidden Springs Road that we talked about earlier, and how the entrance to the facility will be reconfigured such that Trilby Road becomes the main entry into the landfill, and all users, it becomes very intuitive as to how to get to the transfer station coming from the east on Trilby Road. So that's my brief presentation on the transfer station, and certainly we can take questions about that after the remainder of this presentation. The behavioral health facility, so a little bit about that. Commissioner Johnson also touched on the master plan that also was improved in 2018 and really outlined a strategic blueprint for behavioral health services countywide. Commissioner Johnson also outlined the site selection process through a design charrette and a 10-site evaluation that went into the effort prior to the master plan being approved during that same time frame. This particular facility is a little bit smaller, but 58,000 square feet, serving a variety of patients and uses from social and medical detox to crisis stabilization, intensive residential therapy, and administrative offices. This facility will upgrade the intersection of Taft and Trilby along with the transfer station to include geometric improvements, turn lane improvements, and signalization of that intersection due to the increased traffic in that area. Overall, the facility will have about 160 to 200 employees on a 24-hour shift, 60 to 80 patients at any particular time, and visitors. And the facility will be open and operable 24 hours a day, 7 days a week, and 365 days a year. So it functions much like a hospital. Conference room space will be available to the public, so there is quite a bit of public usable space inside the building, which is pretty exciting for this side of town. So that's a nice amenity. As part of the overall master plan, as I mentioned, it created that strategic blueprint for behavioral health services, and it really led to the design of the facility that we're talking about today. This is a kind of a duplication of the information I just presented. So moving on, the site selection process and land use work was done over a 3-day period. 21 participants, including community stakeholders, leaders, and partners across the community. Work included short and long-term needs of the facility, travel distance, population densities that I'll talk about here in a minute, and then where this facility was located relative to the overall county geography. The overall recommended site that came out of that is the one we're talking about today at the northwest corner of Taft and Trilby, and it recommended the current site with appropriate screening and buffers. So, and then certainly was featured inside the the 2018 tax initiative. So with that, a couple graphics relative to that. The proposed site and the relative population densities is shown on this graphic and shown in proportion of population served. And then moving on, this is also a population density and kind of in a hotspot, if you will, map showing where the location is relative to the populations of Loveland, Fort Collins, and the other communities in Larimer County. So a little bit about the facility and the relationships of the facility to the site. So the design team and the architect, Page Architecture, that's been working on this project for a few months now, spent a lot of time looking at the orientation of the facility's natural features, and how it can support the healing process with those who are suffering from mental health issues. And so this particular diagram shows the facility orientation and the uses of the facility relative to how the site can support those, both with existing and future program. One of the main things that was looked at as part of this facility is focusing on light, focusing on the sunrise, the sunset, and focusing on how the building can be oriented to maximize daylighting to provide that healing concept for the folks that are using the facility, and really transitioning them from a sick state to a wellness state. And that's really what the building is and is intended to do, and how it's oriented on the site to maximize views and the use of daylighting. We did do a quick, I wouldn't say quick, but a relative study on the future site master plan. And that's what this graphic shows. The main facility is identified as area number 1 here with the parking and site uses that I've described previously. It also identified future potential supportive uses of the facility that could be built at this site in the future, which could be adolescent housing, supportive retail, and maybe even conference and supporting uses like that conference center, for example. So facilities like that are potentially envisioned if that is what the county feels necessary in the future to support the behavioral health initiatives. This is just an upgraded site plan showing a little bit more detail. It shows the expansion of Trilby Road, a southbound right turn lane, signalization at the intersection, and then a little bit more of an engineering drawing showing utilities and parking of the building and site. A few renderings and graphics. This is an image of the facility looking directly north. It shows the main entry of the facility, which is more of a monumental entry to direct people where to go. It shows secure entry of the facility from the emergency responders on the south side, very easy access through a sally port. And then the calming gardens and green space on the north side of the facility that can be used by the occupants and public. So a little bit closer view of that as well. Looking back towards the northwest. A front entry view again with the secure entry to the south side, and then the associated wings, which are to the north, are crisis stabilization, intensive residential therapy, and to the south, medical and social detox. This is a rendering of the entryway into the facility and the main visitation counter. And this is again an illustration of the light and how the light's used through the facility. So very simple, very architecturally concise, I guess is the best way to put that, with light both entering the facility from the west and the east. And then my last slide is a picture inside the social detox unit. So it's again very open, a lot of daylighting, access to the outdoors, and access to both group areas and individual areas for treatment by the operators of the facility. So that gives you a pretty big picture, broad view of the facility and what it can do and how the transfer station and the behavioral health facility relate to one another. And with that, I think we can move on into questions. So I will stop sharing my screen and turn it back over to Michelle.
Thank you, Keith. I would just before we go into Q&A, I wanted to know if any of our other panelists had anything they wanted to add that maybe didn't get covered before we jump into Q&A. Or if none of you jump in, we're gonna just go over to Q&A. We have quite a few questions, so that's great. Thank you all for engaging. I'm gonna try to group them together and maybe we can hit some certain topics at a time. And I actually wanted to start with one we got a lot of questions about in the pre-survey, the pre-questionnaire, I'm sorry. And it had to do with what is the thought, or what thought has been given to the stigma of putting a behavioral health facility at a landfill? And I'm not sure if Lori Stolen would like to answer this question. And it kind of additionally to that, Lori, we have a couple people that are a little concerned that maybe the traffic noise isn't exactly tranquil, or oftentimes individuals with mental illness will be sensitive to noise. And so how is that going to be addressed at this time?
Thanks, Michelle. Sure, I'm happy to attempt to give an answer to the kind of two-part question there. First, let's talk about a behavioral health facility being put on a landfill. I think words are important, and I want to be very clear in saying that this behavioral health facility will not be put on the landfill. In fact, by law, nothing is allowed to be put on a landfill. It's nearly a quarter mile south of the landfill on some borrowed land that the county owns, and the behavioral health facility is put on a beautiful piece of property that has plans to have connections to walking trails and a very good view towards the northwest and to the foothills. Our intention is to make the focus of this facility to be what the voters asked for, and all of the input that we've gotten from our communities, that it's a warm, safe, welcoming place to come in a time of trouble and a time of crisis, and that it's a place of healing. And so we have been working diligently with our architects and our landscape architects to make sure that the facility's landscaping is complementary to that philosophy of healing. So though it is located on a shared piece of property that's approximately 350, 360 acres with the current landfill, we also know that the current landfill is closing. And so it will truly become a beautiful green grassy knoll that nothing will be planted on here in the future years. Second part of the question was about traffic noise. We certainly understand that Fort Collins and Larimer County is a growing community, and there's not a whole lot we can do about that. The numbers and the people that want to come to our quality community continues to grow. And we know that not too very long ago, Shields was on the outskirts of town, and Harmony Road was bordered by cornfields. And they are now primary arteries within our town. And we anticipate that Taft Hill Road will soon be one of our main arterial roadways between Loveland and Fort Collins as well. So as far as the traffic noise goes, our hopes are that we would be able to mitigate some of that with some of the berming and the screening and the landscape that we put around our behavioral health facility. And unfortunately, the way that the architects have it laid out right now, the parking will be between the road and the building. And ultimately, our goal will be that we will have group rooms, and we will have activities, and we will be doing the business of the work inside of the facility, shielded from those noises. So that's the best I can do to answer both of those questions for right now, Michelle.
Thank you, Lori. One quick other question, and this might be a question for Lou, but whomever jump in. In addition to noise, I know the landfill is closing, but what about the transfer station and odor? Is there a possibility that there's going to be a strong odor coming off that transfer station?
Thank you, Michelle. So to address some of the issues or concerns with the transfer station, it is an enclosed building, and all the trucks will be inside the building as they unload. We also use in our loaders, our front loaders, that we have what they call this whisper sound when the loaders back up, to avoid that annoying beep, 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 beep that you could hear from a county mile. So we've taken precautions with our equipment in order to minimize the noise. As far as odor, the transfer station has an abundance of exhaust fans, and these fans are there to circulate the air. The material will not stay there for any long, significant period of time. Within a matter of 24 to 48 hours, whatever comes in there is going to be loaded into a truck and leave. So if materials are left there for long periods of time, you will get the flustering of odors that kind of emerge. But these are the reasons why the transfer station will be actually a little bit more user-friendly with the management of MSW, municipal solid waste, and all the precautions that we're taking to minimize odor and noise. So hopefully that answers your question.
Thank you, Lou. All right, I'm going to combine. I have a lot of people asking kind of the same question, but were any other locations considered for the behavioral health facility site? And on the same note, what other outside organizations were contacted about this? Was the city involved? Was UC Health involved? Other mental health nonprofits? If someone can elaborate on just kind of the process that went through taking this site.
Again, Michelle, I'd be happy to take that one. As part of the Mental Health and Substance Use Alliance and guidance team and lead on the amendment that we did to the HDR engineering contract for the transfer station and the waste shed study, we piggybacked on their contract to do this 3-day land, site, and design charrette. And at the same time, we had our county real estate group manager, Jennifer Johnson, do a search of land that we specified the criteria for between Loveland and Fort Collins. And she came up with a variety of different land options that weren't necessarily between Loveland and Fort Collins, but what were available at the time around Larimer County. Several of them were in North Fort Collins. Several were on the other side of I-25. And then there was, I believe, one that was between Loveland and Fort Collins in that industrial park near Walmart. And what we found were a couple different situations. One was that they were selling rather quickly. And so by the time we were able to make a decision and purchase land, something that we may have been interested in, it sold. And another issue was the size of the facility. Another issue was the cost. I'm sorry, not the facility, but the land itself. Another issue was cost. And another issue was the opportunity for future growth. We looked at the amount of time it would take to get from a medical facility to this behavioral health facility and vice versa. And we wanted it to be equidistant between a variety of our medical facilities around the county. When we did the site design, we brought in 21 stakeholders, and there were people that were from UC Health. Janice Mearswa at the time was the Senior Director of Emergency Services. We had several people from Summit Stone Health Partners. We had members from the Health District. We had members from the community, and we had members from around different departments within the county. So we feel like we did a pretty good job of getting representation during that meeting for site design. You'll have to remind me, what was the other part of your question? Can't hear you quite yet.
The other part of my question, it was twofold. It was what other, I think you answered them both. What other sites were considered and who was involved in the process of selecting the site?
Yep, there you go.
And a quick follow-up question. I had someone ask, was the location for, sorry, I'm scrolling through. Was the location of the landfill on the ballot in 2018?
So again, I think
the exact question, it's something like that.
It's okay. So when we talk about the 2018 sales tax campaign, we're talking about the public awareness campaign, where we spent a significant amount of time going around to the different municipalities in Larimer County, and we had listening sessions, we had commissioner meetings, and we answered questions. We allowed input and conversation to happen for a good 2 years. And in fact, I kept record of doing about 400 different presentations around the community. And that was where we really had a lot of conversation around the location and the intention behind, the goals of it being a safe, welcoming, and warm place for people to go for healing. And so we know that ballot language itself on an election, on a ballot itself is very limited in words. And we certainly couldn't put every detail into the ballot language. It's governed much by law. And so of course we didn't have every detail about the issue on the ballot, in the ballot language itself, but we certainly did communicate about all of those issues in the master plan and during the campaign up to the election.
Thank you, Lori. Okay, I'm going to give you one more behavioral health question before we maybe move into some transfer questions. And this was asked quite a bit in our pre-survey as well. What's the plan for public transportation out to the behavioral health site?
A really, really understandable question. And it's something that we've talked about internally, externally, and for a really long time. We've worked with our co-responders, our first responders, our EMS partners, our law enforcement partners, and really have an understanding of how people get to services when they're in crisis. We really are comfortable in knowing that there are some main ways that people get to services when they're in crisis. When they're having a mental health crisis, a psychotic moment, they're suicidal, or they have withdrawal or detox needs, right? They're under the influence of drugs. The most often ways people get to that kind of care is either by ambulance, by law enforcement, or by a family or friend. So we are really comfortable in how people get to these services. The way that we want to manage this facility and how people leave the facility is very intentional. And it's a new and honestly, it's an improved way of how we do services around our community. Our goal is to be very intentional about how and when people leave this facility. So we've got dollars that are in the budget for transportation. We want to invest in transportation that's dedicated, that we have a van on site, that we have someone that could be part of the care coordination team, that can be a part of the discharge planning of folks as they're leaving, and making sure that they get to and get connected to the next best level of care that they need. Our goal is the minute someone comes into the facility, that discharge planning starts right away. Summit Stone, our partners and who are going to be providing these services in the facility, working with UC Health. We're already in conversations of what does that look like? What does the workflow look like? That we have a very robust care coordination team that will work on the intentionality of making sure that people get to where they need to go when they're being discharged from this facility. The second piece of transportation is, as part of our current Larimer County 5-year strategic plan, there is a goal and objective that's looking at the transportation to and from this behavioral health facility. We are really excited to be working with these partners and looking at dedicated transportation, such as having drivers, having Uber, having taxis. Medicaid provides funding for transportation for folks. And so our goal is that we would ultimately use public transportation as a very last resort. And if that needs to be a future conversation or a longer term conversation that blends in with our regional transportation conversations that are already happening, as we see Loveland and Fort Collins continuing to get closer to each other on our north and south arterial roadways, that is absolutely something that we will continue to be at the table for.
Thank you, Lori. Okay, I'm gonna, we have a lot of questions, so I'm doing my best. There is some questions that maybe are a little more relevant to transportation, not transportation, but traffic as well as the landfill. So I'm gonna jump to a few of those. We have someone who asks, is a roundabout possible at Trilby and Taft? And maybe someone can touch on what kind of the traffic management plan for that intersection is.
I can answer that question, Michelle.
Thanks, Keith.
You bet. So the roundabout alternative was evaluated as part of the traffic impact study for both facilities, the transfer station and the behavioral health facility. And because of the modal split in traffic between Taft and Trilby, as well as the type of vehicles
and the distribution of vehicles, it was deemed that the recommendation for the traffic engineer was that the signal was the preferred alternative for that particular intersection. So that's the one we're proceeding with based upon the traffic engineer's recommendations.
Thank you, Keith. I'm trying to find, I'm sorry, there's a lot of questions. There was a question regarding, here we go. This might be a Lou question. Has Larimer County thoroughly explored waste reduction and continuing along the same path of use and just throwing it away?
Yes, that's a very good question. And I would have to reference our solid waste master plan, what we call the SWIMP. So the county has spent quite a bit of time, years, investigating what would be great solid waste options rather than just building a new landfill and burying it. And within that master plan, there are components associated with composting, construction, and demolition. And we're also looking down the road at revamping our existing recycling center. As Commissioner Johnson said earlier, it is something that the county has looked at very deeply, and our goal and the expectations of what we want to do is to put in diversion onto the existing campus of what we have where the existing landfill was in place, and then building a new landfill north of here and transporting those materials that we cannot recycle and cannot deem for waste diversion and transporting them there. So this is all part of the big master plan, and that's what this site is earmarked and suited for as far as in the solid waste department.
Lou, I have another question that I think is a little more directed at the landfill.
Sure.
And it's not a clear question, but they're asking about off-gassing from the landfill. Can you talk about that a little bit?
Sure. So landfills tend to create methane gas. As landfill ages, they naturally develop landfill gas, which is captured and could be used for energy. We do have such a program in place. We are capturing all of the landfill gas. At the moment right now, it is being flared, but we do have provisions with a company that is deemed to take that material, that gas, and turn it into a fuel alternative for energy sources. Unfortunately, due to the low price of fuel and due to the low BTU content associated with our gas, they haven't pulled the trigger on that project yet. But as it hits certain thresholds, we do have that mechanism in place with our existing landfill and have the means to turn it into energy when the suitable conditions hit right.
Thank you, Lou. All right, I do have someone with their hand raised. Mary Freeland, it looks like you have your hand raised and you had a lot of questions. So I thought it would be best to let you talk and ask your most important questions. So what I'm gonna do right now, Mary, is I'm gonna give you the ability to talk, and what you need to do is you need to unmute yourself. So there's probably an unmute button somewhere at the bottom of your screen to unmute yourself. If you're on a phone, if you dialed in, which I don't think you did, it looks like to me that you're on Zoom, but you need to unmute yourself, Mary, probably somewhere at the... Are you there?
Yes.
Oh, Mary, go ahead.
Okay, so I asked for the, I think the man's name is Mr. Myers, who put up some maps.
Yeah, Keith.
I was interested in the map that showed I-25, all of the different roads. I'm wondering about the trucks coming. He said 30. They expected 30 trucks to come into the transfer station every day, and yet your information said 30 to 40 trucks every day, which is another 10 trucks. Are those trucks expected to come down Trilby and Taft Hill, or just one or the other? And that was one of my questions. I have several more.
Okay, so let's see if Keith, can you maybe share your screen again with that map?
Nope.
He's getting there. Take a second.
Okay.
All right. And I don't know, Keith, if you're the right one to answer her question or not.
I was confused. Am I still talking?
You are, yeah.
I was confused with what he was talking about here in terms of what has been happening or what will be happening. I see a primary haul route down 25. I see an alternate haul route, and I see a secondary alternate haul route. So tell me more about that map, please.
All right. And Keith,
That's probably best for Lou, Michelle.
Okay, Lou, go ahead.
Sure, sorry. Let me get my video on. Wow, for some reason my video is not popping on. Hold on.
That's okay. We can hear you.
You could hear me? Yeah, that's good. So, Michelle, our initial primary road is going up I-25, and this will be in the future when the new landfill is up and operating. So currently, no trucks are going down these routes at the present moment with our existing landfill. Our primary road is the one that's in pink or purple, whatever your color is looking over there. And that is leaving our site and going up I-25. It gets off right at the Owl Canyon exit and then heads up Route 9 to the new landfill. We have in our master plan other alternative routes in case there's a traffic jam or I-25 is closed for one reason. We do have the option to go up Taft Hill Road, but that is not one of our primary routes. So we looked at alternative routes just in case there is a traffic condition or there is some kind of condition in place where we can't go through our primary route. The blue one represents continuing on I-25 and getting off at Buckeye and then heading south on 9 to our new landfill. So these are just alternative routes in our master plan, but based on the traffic study, what the engineers recommend is the I-25 corridor and getting off at Owl Canyon Road and then heading north on 9. So hopefully that answered your question.
No.
Mary,
So,
Mary, real quickly, there was someone who asked a very relevant question so I just want him to touch on that really quick before we let you continue, okay?
okay.
Lou, can you explain why it seems like most of the traffic is really needing to go northeast? Why do they have that primary chug traffic go south initially?
So the main traffic route is the one that you see in the purple. That actually gets off at Owl Canyon and then heads north. The blue represents an alternative traffic route in case there is something, construction or something taking place that they can't exit there. That is another alternative.
I think they mean coming out of the landfill. Why does it go south instead of go north?
So sorry, I misunderstood your question. So going south, we would then hit Trilby Road and eventually get on Carpenter Road. So as we exit out of the existing landfill, we head south on Taft, hit Trilby, and then head over to Carpenter Road and use Carpenter Road as an eastbound to get to I-25.
Was there like a specific reason why they chose that route?
That was what the engineering traffic study has shown. And I think Lori wants to address that one a little bit better. So I'm going to pass it on to Lori Cadridge.
Lori, go ahead. I can't hear you, Lori. You got to unmute yourself.
Doggone, and I was halfway through my answer on that one. The reason that we looked at this had to do with timing. We don't want those larger vehicles to be stopped a lot or have to stop at traffic signals. I'm sure anybody who has driven near one knows that that slows down the traffic and causes more noise and emissions from the vehicles. And so as our engineering study and our traffic study took place, we looked at how quickly could we get the transfer trucks away from the new transfer station and then to the new landfill. And this is the route that has the least number of stops and the quickest timing to get there. And believe it or not, even though that route is a little bit longer, by going the green route, it takes 5 to 9 minutes longer to take the other route.
Thank you, Lori. Mary, go ahead. I'm sorry I interrupted you.
Okay, yeah, that's fine. So it says here Larimer County landfill. Is that including this new proposed transfer station? Hello?
Yeah, I'm waiting for one of my experts. So hold on
Okay.
just a second.
I'll cover that. So the Larimer County landfill, that's down in the southern part where our existing landfill is, will have a transfer station on it. The route that we're talking about is what we call our north landfill, and that is up by Wellington.
Correct. Right. So let me try to understand this. We are going to have 30 to 40 trucks coming up Taft Hill Road, or I'm assuming that it's 30 or 40 trucks total that will be divided possibly between Trilby Road and Taft Hill Road coming into the new proposed transfer station. Then at some point, the solid waste, which maybe a homeowner might just call garbage, will then be loaded onto some 30 or 40 more trucks and take this route back down Trilby Road and then to Carpenter and up I-25 to the new property up there for the new dump. I'm just kind of wondering, just overall, why we would have a transfer station in such a place that is going to have traffic going in and out, in and out, in and out, when Loveland and Estes and whoever else is using all of this. Wouldn't it be more of an idea to have a transfer station somewhere else, like south, but close to I-25? And we were talking, you were also in conjunction with the health facility. The health facility, they've talked a great deal about how peaceful and lovely and the land being, a lovely, serene place. And yet we're also building another dump there, a new dump, although it's enclosed dump. It just, to my sense of reasoning, does not make sense. But especially the transfer station does not make sense just because we own the land. Apparently, Larimer County has only this piece of property. That's another question. It has no other pieces of property?
So, Mary, that's a good question. So I think that you've asked a couple questions that I want to get answered, and then we need to move on to some other people that have questions as well, but I'll try to get some questions answered that you asked. I think one of your questions had to do is there are 30 to 40 trucks coming in and then 30 to 40 trucks coming out. And please correct me if I'm wrong, Lou, The 30 to 40 trucks is a 1-day amount, so it's not double. They don't count them once when they come in and once when they come out. It's total in 1 day, correct, Lou?
Just because I'm already up and ready to go, I'm going to get that one. It is 30 to 40 trucks going to the new landfill and 30 to 40 trucks returning back to the old landfill. So it's going to be about 60 trucks total, we estimate, to begin with, and that's roughly 3 an hour.
And how does that compare, Lou, to what we see, or Lori, either one of you, what we see coming in and out of the landfill today? What's the comparison between those two?
So what folks are going to see is similar numbers in terms of private vehicles coming into the landfill today, and they will use the new transfer station. You won't see the same kind of queuing that you see right now, and there shouldn't be the same traffic impacts because that will be internal to the new transfer site, and we are building and planning to handle that capacity. The thing that will be different is that the route trucks will come to the new transfer station. They won't go into the old entrance. So folks will see the route trucks, you know, whoever your private carrier might be, or the commercial carriers, or the trucks from Loveland will all go into the transfer site location and go inside of a building where they will dispose of the materials that's within their truck. That will be loaded on those new 30 to 40 trucks a day that we've been talking about, and then consolidated. All the trash will be consolidated in the larger vehicles and taken to the new landfill. The thing that will be different is that the trucks that are in the northern part of the county, closer to the new landfill, those commercial trucks will go directly to the new landfill. So even though there'll be new trucks associated with the transfer station, there will be other trucks that will go directly to the new landfill and won't go to the landfill like they do today.
Lori, one final question I think Mary had, and I know we talked about alternative sites at the behavioral health facility, but Mary was curious if why the transfer station isn't considered on a different site, maybe south of town, near I-25, and was there alternate sites considered for this transfer station? Or what was the process for that?
Yeah, I could answer that one. So the route trucks, all the vehicles that have been coming here for the last 58 years have been coming to this site in order to dump. If we move the location to another area, we would need a piece of property that could contain and hold all those vehicles and that traffic flow. Since this is already a natural site and trucks have been coming here for years, we thought it would be a natural progression for the vehicles to just continue to come, the route trucks to continue to come here. And then all we have to do is consolidate the materials and then transfer them up to the new landfill. It also gives us the ability, if the materials are coming here, with our plans to expand the area for landfill diversion, composting, construction, demolition, and recycling, you want all the materials coming to one source. If we had these materials scattered in other locations, then you're just wasting time running around, moving and transferring materials from one location to the other. So with the closing of the landfill, this will act as a natural hub in order to attain all the waste materials and then give us the ability to do a diversion and then take the leftover materials and then take them up to the new landfill. So it was just a strategic location because of the fact that vehicles are already coming here. They've been coming here for years. We have the land, we have the property, and we are developing new infrastructure for diversion. And it's better to have that in one site than to scatter it all throughout the county or other urban locations. That was the main reason why this was chosen.
Thank you, Lou. Actually, that's a very good transition. We're going to move back over to behavioral health for a little bit. And this may be a Lori Stolen question, but one of our attendees wants to know the reasoning for a singular facility for behavioral health. How is this site accessible to potential users in the rest of the county?
Great. So through much of the research that has been happening around behavioral health, honestly, in our community since about 1999, and we can thank our Mental Health and Substance Use Alliance that staffed through the health district and many of the partners that are around the table weekly with Summit Stone, with the health district, with many of our behavioral health providers in the community. What we know is that when you put services together, there's an economy of size, and there's also an opportunity to blend licensing. The world of behavioral health care is very complex, and it's not my intentions to go into a lot of the details tonight because we certainly don't have time. But when you're able to provide a holistic approach to care in one facility, you're able to be able to provide better treatment for people. It makes more sense to provide care in one facility than it does to go here for this and over here for something else and somewhere else for something else. And so when we were doing the research, we brought in some national consultants as well as our community experts together and made some decisions about what was logical to put in the same facility. And we want to be able to fill the most critical gaps that we have in our community. The goal of this behavioral health initiative isn't to solve all of our social problems. Certainly there's not enough money to be able to do that, but to be able to address the most critical gaps that we have in behavioral health care. So one facility for our crisis hub, and that is just one component of this behavioral health initiative. Another component, which is equally important, is our impact fund, which is the grant program with intentions of putting millions of dollars a year back out into the community itself to expand and enhance community-based behavioral health care, with honestly the ultimate goal of reducing the need for crisis care. If we can get upstream and we can do early identification and early intervention really well, we'll have a reduced need for these crisis services. But we also know that it makes sense to have a hub of these services in one location where we can have an economy of different levels of care together.
Thanks, Lori. I have a couple follow-up questions since we're kind of talking about it. We have some individuals, are these two kind of go together? What's the inside of the facility look like, and who's going to be providing the services?
Right. So we have contracted with Summit Stone Health Partners in partnership with UC Health to be the providers of the clinical services in the facility. We are in conversations about what are all of the contracts that we will need to really build out all of the needs in this facility for food service, for linens, for pharmacy. You know, there's a lot of moving parts in this, and we're really happy to be in partnership with the largest behavioral healthcare provider in our community to be able to roll out this new program. It's really precedent setting, it's history making, and the nation is watching. We are combining 6 different levels of service that we just are having a hard time around the nation finding another location that is doing it the same way. So we are really excited to be able to provide these services together in this facility. So the providers are Summit Stone and UC Health. And again, I'm going to need to be reminded of the other part of your question.
Nope, those you answered the two, but since you answered them, I'll just throw another one in there.
Okay.
How many detox beds are going to be available?
Great, thank you. So let me just give a breakdown of the beds in this facility. It's a 64-bed facility, and the beds are broken down into a crisis stabilization unit, an intensive residential treatment unit, and then medical withdrawal and social withdrawal. So it's not quite as black and white as an answer of how many detox beds there are. It kind of depends on what level of care someone needs. We could have someone that has detox needs in our social area or in our medical area. In the combination of those two, there would be 32 beds, 16 in each, but they're flexible, right? Depending on the population needs that we have. We also have the opportunity to hold people in our behavioral health triage hub that we're working with to determine what level of care that they need if they're in crisis and we need some assessment time to determine, do they need detox or do they need to go over to our crisis stabilization unit? So we have some additional beds in the behavioral health triage hub to be able to manage folks as well.
Great. And then one last question, and I think this is for you, but I could be wrong now that I'm reading it out loud. What is a supportive retail building? Was that part of the behavioral health site? Good.
Thanks for addressing that. Yep, Keith went over some things on one of the slides earlier that was looking at the potential future partnerships on this campus. And so some of the ideas that were brought up throughout many of our community conversations are around, what about services for adolescents? We are really short on community-based services for the youth in our community. And so 2 of the identified buildings that were on that slide were included adolescent treatment services. And then when you talk about a retail, it really doesn't mean Macy's or TJ Maxx. It's more meant to refer to primary care or dental care or vision care, things that would make sense to put in close proximity to other levels of care for high utilizer populations. Another thing that was pointed out on that slide was the potential to partner with our housing authorities to have permanent supportive housing on that campus. That doesn't mean that this initiative would pay for permanent supportive housing, but it would mean that we could partner with maybe some staffing that's needed for high utilizers that have behavioral health issues, case managers, care coordinators, and we would partner with other people in the community to continue to close the gaps in the different levels of care that we still have a shortage of in our community. So the word retail is used in a way that doesn't really refer to shopping, but more towards different levels of healthcare that needs that people have in the community.
Very good response. I learned something new tonight. Thank you, Lori. I've had several people, and this probably can be answered by multiple of our panelists, but there's several questions about what type of outreach was done to the surrounding neighbors of both of these sites. So whoever wants to answer that one, go for it.
Well, since I was sort of the face of this behavioral health initiative from the 2016 failed ballot initiative, when the commissioner said, man, this is still a priority in our community and we really need to figure out what's going on here. So let's have you go out into the community for 2 years and figure it out. I just can't tell you how much community engagement we did. I mean, it was daily. For 2 years, we went to each of the 8 municipalities. We spent a lot of time in Estes Park, in Wellington, down in Berthoud, in Loveland, in Fort Collins, talking to all levels of folks. We talked to people that had lived experience. We talked to elected officials. We talked to civically engaged groups in the community. We hosted meetings at coffee houses. We really did our best to try to listen and hear what people's concerns were, what their needs were, and to answer questions as this project was unfolding. So throughout our public awareness campaign, which I had Nina Bodenhammer helped me out with it early on with the Mental Health Matters. Many of you remember the orange brains that went around for years. Some of you may still have them by your coffee table. We did posters in coffee houses. We did mailers. We did listening sessions. We did a lot of different outreach to our community to listen and to get input, which I think is what strengthens this project, that we are able to provide the funding through the grant program as well as the services in the facility. We are providing these things because we've listened to the community to hear what their needs were.
Thanks, Lori. I'm wondering if maybe the other Lori or Lou or Ken can maybe even Keith, any of you, talk about a little bit about the public outreach to the neighbors about the transfer site. Don't forget to unmute yourself, Lori.
Doggone. I can start that, and if somebody else wants to add to it, that would be helpful. A lot of the outreach along the transfer station was done with our adjoining neighborhood, the Hidden Springs neighborhood, because we knew we had concerns from that neighborhood, and we've worked with the neighborhood for many years about traffic that would go into their neighborhood, and even today try to access the landfill at its existing location. And so a lot of our more specific outreach for neighbors was there. The more broader outreach was done when the solid waste master plan was underway. And that was about 6 years ago and occurred over a 4-year period of time. Many of our partner agencies participated in that. There was a policy council and then a stakeholder group from the community of over 100 participants that all helped shape what our waste shed plan will look like for our region, including the location of the transfer station.
Thank you, Lori. I'm looking to see if anybody else wants to jump in. I have a really good question. Well, they're all very good questions, but this is an interesting question. Was there ever any consideration about swapping the two sites? So having the transfer station more towards Trilby and Taft Hill, and then the behavioral health facility farther back? I'm curious, I don't know who would, maybe Ken would be the right person to speak on that, but if that was considered at all.
Thank you, Michelle. That is a very good question. I think we had talked about it real briefly at one point. The projects at one time were moving at different paces. The transfer station had quite a jump start in terms of the pace and timing. Lori just mentioned, the 6 years ago, a 4-year window of input, process that was happening, as it related to the transfer station and the long-term plans for the site. The behavioral health location was a process and a determination that happened much later, and so there was a good amount of design that had happened. There's already been obviously an awful lot of design and engineering that have happened between the two sites, and I think that's probably where we're at with it. We've spent a good share of money to to process and move through the design process for both of these projects. If there was discussion about a swap, it wasn't a specific direction that we were headed for any particular reason. We had a good amount of design again that had happened, following the master plan for the solid waste piece of it, and would have required a lot of undoing of that project at that time, and the public process that happened with behavioral health, was following that by quite a long time. I'm hoping maybe Lou can give a little bit of a further backdrop for for the pieces that preceded locating the transfer station, specifically where it is, and that may help give a little more backdrop to that decision, and kind of help explain the direction to head that way, and then ultimately be able to support the the work that was happening for the transfer station by locating the behavioral health facility at that southwest or southeast corner. So thank you.
Yes, thank you, Ken. I think I could add just a little bit more thought to that. As we were planning out the infrastructure for the solid waste plan, we had other areas that we were deeming for recycling and landfill diversion, a compost facility, a C&D center. All these are on the northern quadrant of our landfill site on the acreage that we have out here. And we just thought it would be for accessibility purposes and infrastructure purposes, where we have water and other infrastructure, particularly for composting. We wanted to deem these locations, and we thought it was more suitable to have the transfer station closer to these other adjacent properties as opposed to the behavioral health. It just made sense to put the behavioral health in its own kind of corner of the world, separated by lots of greenery, lots of space, and then concentrate the transfer station and the other infrastructure on the northern quadrants of our site. And that was part of the sort of the master plan of the site development work that took place when we were putting the engineering and locations together. So hopefully that answers a little bit more.
Thank you, Lou. Since I have you there, I have one quick other question that's related to the transfer site. What are the hours of operation for that site going to be?
The same as our landfill, 7:30 to 4:30, Monday through Saturday.
Very good. Now I have a question. It was actually one of our very, very first questions raised. I think everybody knows that the city of Fort Collins has brought up concerns with the site. And is anybody, I don't know if any of our panelists know how their search for a new location is going. Is there an update that we could give on that? Ken, go ahead.
Yes, thank you, Michelle. Yeah, they did reach out soon after within a couple of weeks of when the letter came from the commissioners, back to City Council in Fort Collins, and they had mentioned, obviously, the commissioners had asked for representation from all the different, municipalities and folks that would be impacted by, potential change in direction for the site. Jennifer Johnson from our team in facilities is part of that team now from the city of Fort Collins. She's acting as a resource. I believe there's 9 people that are part of that team from Fort Collins, from the city of Fort Collins. And I believe they've also reached out to some of the other communities, some of the other municipalities to participate. I don't know if that's happened, and that process is ongoing. We do have a work session set up with the commissioners on August 3rd. And so the commissioners and basically county leadership is anticipating that there will be some level of reporting back from that team, again, from the city of Fort Collins to the commissioners with ideas or, pieces and parts of their, concentrated search now in this 45-day window. We do anticipate that there will be reporting back on August 3rd.
Thank you, Ken. Commissioner Kafalis, I see you're unmuted. Did you want to say something?
I would just add to, thank you, Michelle. I would just add to Ken's comments that the work session on August 3rd is a public meeting, and folks can access that through the internet, or I think it'll be broadcast. So that's important. And I also believe that the city of Loveland has dedicated some resources to help with this search. So I wanted to add that. Thank you.
Thank you, Commissioner. Am I unmuted? I am, sorry. We have a lot of people that have a lot of comments that they've put in through the Q&A, which I think meant all of them are very valid comments. They're not necessarily questions to be addressed, but I wanted to let you all know there's more than we could possibly even address here in the time we have left. So what's going to happen is we're going to have all of these comments and questions. All of the panelists are going to look at them and they'll respond to them as necessary going through. I know we're running a little low on time, so I just wanted to address some of the other questions that I think that have been asked by several people. And this is a fair question, I think. So did the county undersell the behavioral health facility and now finds itself stuck with an insufficient budget in order to purchase a more appropriate property? And I know, Lori, you addressed this a little bit when talking about the process you went through after the failed ballot measure in 2016 about outreach. But I wondered if maybe you wanted to clarify again just exactly how this site was chosen and why, and to answer his question of, is this a decision being made based on budget?
Thanks, Michelle. I think that money always comes into the picture, and how much money do we want to put towards land versus how much money do we want to put towards the services that are being provided in this facility. So I would say certainly there's budget considerations. We also know that land in Larimer County is growing more and more expensive all the time. We're wanting a piece of land that has the opportunity to grow into a campus, a wellness campus that would be accessible for all residents of Larimer County. In order to have a piece of land large enough to do that, the market rate is high. To have it in an equitable location that's not one municipality centric requires us to look at a bandwidth of land between the population centers of Larimer County, which is Loveland and Fort Collins. And so we tried to focus on land that was available between the two largest municipalities. When we talked about where it should be located with Berthoud and with Wellington and with Estes Park, they certainly understood that they are smaller municipalities. And in fact, they said that they would not desire to have a large behavioral health facility in their communities, but they would want to have the services available for them if and when they needed it. And so when we looked at different properties, again, our real estate manager, Jennifer Johnson, who's been mentioned several times this evening, did the search for available land. There were several issues that came up. One, they were selling quickly. So someone had mentioned earlier that a piece of land in the industrial area near Walmart would have been more ideal. No, it doesn't really matter because it sold, right? So pieces of land that we looked at may have been considered, but they sold, they were not available. Other pieces of land that we looked at weren't affordable. There wasn't money allocated to spend $6 to $7 to $8 to $10 to $12 to $20 million on a piece of land. So we had looked at a small plot of land off of Carpenter, someone else had mentioned, very early on during the 2015, 2016 timeframe. And that piece of land was deemed to be, it wouldn't even host the building and the parking that was needed. It was 5 or less acres. And so when we started looking at the size of this facility that was needed and the parking that would need to go with it, it provided no opportunity for growth or expansion. As someone else mentioned in the questions, the population of the county is continuing to grow. We absolutely are looking at building this facility with growth and future in mind. We're designing the building so there are places on the building that could expand out to add beds as needed. So ultimately, when we did the 3-day site design with HDR engineers and our stakeholders, it wasn't something that we could invite the mass populace to. We invited our primary stakeholders. And so 21 representatives that may not sound like a good sampling of Larimer County population with 356,000 people in the population of the county. But what we did was pull 21 subject matter experts and stakeholders and partners that really know a lot about behavioral health together to make this decision. And, you know, I've said it before, I've said it for years, I don't believe that there's such thing as a perfect location. I really don't think that there's a perfect location. You know, beauty is in the eye of the beholder, and what might appeal to one person might not appeal to someone else. But what we did was measure the pros and the cons. We listed out what the pros and the cons were, and ultimately there were more pros to this site selection than there were to any other. There were more pros that we listed out than there were cons. Is it perfect? No, it's not perfect. Is there anything on this site that's unmitigatable? We felt not. We felt like that it was a good partner. It's a large enough piece of land that it could successfully co-locate these two county services on one piece of land. And so we have moved forward with the architects. We've moved forward with the design of this facility and have focused on making it the very best that we can with what we have. That's the best I can do to offer an answer to that.
That was a great answer, Lori. Thank you very much for that. And I know we're running low on time. It's about 7 o'clock now. So I wanted to just wrap up a little bit and talk to you guys about next steps. So there, as I said before, there was many questions, many comments we didn't get to. We see those all and we know they're all valid. And so what, as panelists, we're going to do is we're going to take those comments and questions and we're going to get back to you guys as necessary on those. Additionally, what I'm going to do right now in the chat box, not in the Q&A box, but in the chat box, I'm going to send you guys a link What this link is to is the page we announced this meeting on. Shortly after this meeting today, I'm going to have the video recording of this meeting. I'm going to get it on YouTube. And then what I'm going to do is I'm going to make the post-survey questionnaire live. And those will go on this website here, hopefully within the next couple hours, as soon as Zoom finishes processing the video. And then tomorrow, you should all receive an email thanking you for joining us this evening, of course, but with also a link to the questionnaire as well. So I encourage you guys, if you didn't get a chance to ask your question today, please use that as an opportunity to continue to give your comments. I know that everyone is very passionate about this topic, which is why here on Wednesday night at 7 o'clock, we have a bunch of people who are here engaging, and I know that all the panelists speak with me when they say that we appreciate the time and the energy and your commitment to Larimer County and making our community better. So with that, I am wondering if my panelists have anything they want to close with. Commissioner Kufalis, go ahead.
I suppose since I'm the commissioner, I'm the proper person to offer some closing comments. First of all, I want to express, I'm not just saying this, but I want to express my sincere gratitude for the 50 or so participants on this, in this virtual open house, this discussion. I think overall it was very constructive. And frankly, to be honest, there were a number of takeaways that I got from this, this conversation, this discussion that I'll bring back to our shop. I think there were some great insights. So I'm, again, expressing my gratitude. Thank you for folks. Thank you to folks for participating. And I think the discussions we're having with the city of Fort Collins regarding the search, the collaborative search for another potential site for the behavioral health facility, it'll be interesting to see what the outcomes of that are. And I think that's an important next step. And we should know some more details about that August 3rd. So again, I say thank you, and my door is always open.
Thank you, Commissioner, for joining us tonight. And again, thank you to all for being with us on a beautiful Wednesday evening. Again, I hope you guys participate in the questionnaire. You'll receive it in your email sometime tomorrow. But if you're eager before that, again, there's that link in the chat box that you could copy and paste right now. And wait anxiously by your computer to fill out that questionnaire when we get it live for you. So with that, thank you for joining us. Your email tomorrow will have my contact information if you need to get in touch with me about anything tonight or anything about the county in general. I'm always here to help you guys out. So thank you and good evening.